Good afternoon. I'm James Frickton, and the presentation of this is a personalized activated care and training to prevent chronic pain in this opioid crisis. And this really complements the two presentations that were done very well, because how do you really support patients in their daily life when you taper off opioids? And this is a program that we developed in order to accomplish that. And so let's see if I can go forward here. Disclosures. No off-label use, support of NIH funding to develop this program. I have a clinical practice in pain, and I helped develop the Pac Program and is part owner in implementing it. So as you know, I don't need to tell you this, that 9 out of 10 people have pain conditions. It's the #1 reason people seek care. A Mayo Clinic study did find 2/3 of every visit was involved in pain to some extent. Very common problem. Clinical research findings, this is multiple studies, found that more than half the people seeking care for pain conditions at 1 month after onset still have pain 5 years later. So are we succeeding in our interventions that we're providing? And why? The studies have shown that patient-centered risk factors lead to failed treatment, delayed recovery, chronic pain, dependency, and passive treatments. Things like repetitive strain, not sleeping very well, stress and tension and anxiety. I mean, we need to manage these, but how do we do that? So the Academy of Medicine, the Institute of Medicine, in their 2011 report did say that our primary role in pain management should be guiding, coaching, and assisting patients in day-to-day self-care. It helps reduce those risk factors for treatment failure, improve long-term outcomes, of course, higher patient satisfaction, and we find that routinely in our care, and reduce long-term costs of care. However, it's a problem. We don't do this, or at least traditionally hasn't, because it's not part of the medical model. There's no time to train patients. There's no reimbursement. There's no tools for health professionals to use. And we spend a lot of time on the tedious electronic record show. So it's really hard to integrate comprehensive whole person self-care as part of routine treatment for the patients. So what do our patients want? And this is really clear from my perspective. And for the last 40 years, I've been a pain specialist working with these patients. They want success in relieving pain. They want cost-effective care. They don't want any risky drugs and treatments. And that's why tapering opioids is really a good strategy, and replacing it sometimes with cannabis and other strategies. They want to understand what's causing the pain. Why is this persisting for 5 years, every day, all the time? They want to know what they can do to improve their long-term pain, and they want to really be treated whole. They don't want fragmented care. They really want to say that the whole person is what we really need to do, and they want to be realistic about their treatment outcomes. They know it's not going to be a quick fix. There's no quick fixes for chronic pain. So the solution that we've kind of come up with over years of development of this with NIH funding, research, and clinical implication is a model we call transformative care, where we do still do our treatments, our interventions, our medications on occasion whenever we need that, of course, our injections, things like that. But we also add self-care training to that treatment plan. And we do that through telehealth coaching and technology right now. So to do that, we implement medications, therapy, injections. We train the patients in self-care. Now, I don't do that personally, of course. We have a comprehensive program to do that. But it's to reduce identified risk factors with protective healthy actions. So, and we do coaching to support the patient every couple of weeks in achieving the goals and reinforcing and supporting them in achieving those changes, and really helping in decreased medication use as needed too, is very helpful. And then the technology we do, and it is reimbursed for risk assessment, self-care training. So we have micro-learning lessons to say, okay, here's the problem. Here's why it's a problem. Here's what you can do for it in terms of a self-care strategy. And then we have health coaching, progress assessments, resources, handouts, books, all integrated as part of routine care, and all done in the background. It's all telehealth. It's all virtual. And so health professionals, I introduced this within my clinical practice, very simple. I said, we're happy to provide treatment for this condition, but it's more effective long-term if we also train you to reduce the causes through a self-care program. Are you interested? So it's shared decision-making, as you mentioned. Very important. if patients are engaged, and I get about 95% of my patients engaged, say, yes, of course, I want to reduce the causes. What are my causes? And so we do that through and we tell them that long-term success is really based on maintaining your self-care over time, whether it's exercises, posture, reducing strain, improving their diet, improving their sleep patterns, reducing stressors, shifting from negative emotions, whatever that is. So we developed this digital sort of platform with coaching as part of it. And coaches, I'll talk about coaches in just a second, but it allows transformative care to be easily implemented into routine care so that we extend our care into the patient's daily life, which is really critical. And so it includes this, we call it the Pac Program. It's personalized, activated care and training. We have telehealth coaching, a whole person pain and risk assessment. So we understand the whole person and all the factors. So it's a very comprehensive, but it really takes only about 15 minutes to fill out because we've taken a multiple instruments and sort of consolidated into very simple, straightforward assessments. We have micro lessons to train the patients in reducing those risk factors. We implement protective self-care actions. So we're not trying to reverse negative problems. We're trying to implement healthy actions on a daily basis. We do a lot of healthy habits, mindful pauses throughout the day, calming meditation, amazingly effective for pain management. And then we remote monitor the progress. So the patients get, progress assessments that we then can track how their pain is going. Even though they're not in the office, we can see and really extend our care. And it also does billing documentation and appointments with a health coach, and it's reimbursed by health plans. And I'll talk about that in a little bit. So it's like an electronic medical record, only it's for patients. And it really, so EMRs cost 5% or more of revenue, whereas this is a patient engagement platform for patients. It has coaching involved, coaching documentation, patients' personal self-assessments, resources, et cetera. And it does generate positive revenue for the provider versus the electronic health record. And so we've spent many, many years developing this strategy because I just didn't have the long-term outcomes that I really wanted in my patients. And so we did a lot of pre-development research to identify risk and protective factors for chronic pain. Then we did a conceptual evaluation. This course is available for if you want to, it's a 20-hour course going into all these risk factors and all the science behind it. If you want to take it, it's free. It's through the University of Minnesota, but through its Coursera out of San Francisco. You can look at that. Then we did a randomized clinical trial funded by NIH to look at, in addition to routine care plus a handout, self-care handout, versus routine care plus the Pac program. And we found significant improvement in everything. So it really adds to the significant outcomes, both long-term and short-term. And then we did a clinic pragmatic trial, about 500 patients, to make sure that insurance companies reimburse this, because it's not going to be used if it's not reimbursed. We understand that. So here's the steps in using PACT. It's really the patient presents with a pain condition, the provider consult, we introduce self-care in the PAC program with treatment. It's not a replacement for treatment, for interventions. It's to supplement. And then the patient, an order set, simple, very simple, an order set, just like ordering physical therapy, an MR scan or other things, prescription. You send an order set, patients are contacted, they're enrolled in the program, assuming they agree. They register, complete the assessment. They go through the training, they follow up with support from a health coach, and then I follow up about once a month over that 6 months to just reinforce that, to provide treatments, injections if needed, sometimes taper their medications more often than give them medications because they're getting better. Their pain is getting under control and they don't want to take medications in general. So the timing is, like I said, about a 6-month program. They do assessment before their first visit with a coach. So the coach knows who this person is from all aspects of their life. And they have 10 health coaches about once every 2 weeks. They're about 45-minute long. They have 10 assessments. With training, we bill out for both a health coach visit and these risk assessments. And we have a training module that's about once every 2 weeks. They have to do the action plan every day. It's like if you're hungry, you eat. If you have pain, you do stretching, you do posture, you reduce the things that are causing your pain. Patients quickly learn what's causing their pain when you explain it to them. And the coaches do a lot of explanations on that. And then the first step is completing those assessments, detailed assessments so we understand and we document. Also, we do a lot of data analytics on this too. And then the risk assessments. And then we also then train, these are personalized cognitive behavioral training micro lessons. They learn why and how to reduce the risk factors. They have personal stories of real people who have gone through this program, daily action plans. I mentioned the healthy habits, pause, mindful pauses, and calming practice. And then we help them overcome barriers to self-care. And the coaches really support this. And there's a lot of research evidence behind all of this, and I don't need to present that. I'm happy to send a white paper to you on it if you're interested. But the coaching is really, really helpful. The patients love coaching. Someone who calls them and talks to me, they're video conferencing over the phone. They prefer the phone, interestingly enough, and they work on achieving the goals. What's your goals and how to focus on that? Oops. Then if there's about 30 to 45 minutes, they do their assessments, they help them set and achieve goals, they implement their action plans, and they encourage this adherence. And we have an 80-20 rule. I mean, no one's perfect. You're not gonna do this every day. We just want you to do it most of the time, and you're going just stretching. I had this 74-year-old gentleman who had 30 years of head, neck, and back pain. Last 10 years, opioids every day. He wanted to get off the opioids. He came to us. We put him in this program. We did some interventions. Also, we tapered him or talked about getting off medications. I wasn't prescribing the opioids, and so I couldn't taper him. But he made this decision. So he came in about 3 months later, was just so excited to see me. And I said, well, what happened? He says, I have not had one opioid tablet in the past month. Completely off them after 10 years every day. And I said, well, what helped the most? And it was interesting. This is a 74-year-old gentleman. He said, well, I'm stretching every day now. The muscles that are tight and sore, I stretch out and they feel comfortable. And secondly, I do calming meditation every day. So he does that about twice a day. Just 5 minutes, deep breathing, you've probably all done it. And it was amazing. So he's just progressed, and I haven't really needed to see him much because his long-term outcomes are really successful. So we really encourage that adherence, improve that success, and identify red flags. So there are patients who are depressed, suicidal ideation, abuse, things like that. And we do get them involved in mental health support also. And the coach really helps. Sometimes I miss that, because I just don't have time sometimes. The coach identifies it, calls me, we work on what's to do. And then there's an outcome measure, so you can go online and just sort of see the progress that's happening with the patient over time. Reimbursement, this is really a critical thing. I've worked with every health plan, United Healthcare, Blue Cross Blue Shield, Aetna, we have preferred one in Medica in Minnesota. So I've met with all of them. And I said, listen, this is really important. What do we do? How do we get reimbursed? And so they suggested a code 99409, which is preventing substance misuse and chronic pain. And it's a fee submitted for each one of those visits, $165. 90% of the claims have been paid. And Medicare pays for it at G0397 at the bottom. So the mean fee, we're in network, of course, and so there's always deductions about $100 mean fee paid, but it does provide net revenue for the provider as well as, pays for all the expenses, and it's cheap. It's like the whole program is like $1,800, something like that. So it's just really relatively inexpensive. So with that, we have the International Myopain Society, and Dana Taylor is here as the executive director. We're collaborating with them on a campaign to prevent chronic pain in the opioid crisis and to really implement a strategy like this. So happy to answer any questions you might have about it. And if you're interested, you can contact us. I will be at that innovation sort of program tonight also, the hackathon. So I'll be presenting something because it is part of a startup company. I'm an academician, but we're working to try to implement it more broadly. So if you're interested, happy to talk to you further about it.